All right, so welcome to the third annual Family and Researcher Roundtable series. We have our kickoff series here with two people that probably do not need introductions in our community because everyone knows them, I believe, fairly well. But we are going to talk about the different opportunities for research studies and research participation on a family level. I know we all have a lot of on our plate, but we want to make sure that you know what is available for you as we try to move things forward in our SENA community. So, as we look into this series, we're actually going to have five different episodes, all with a family focus lens of different research and different education opportunities, just to not only educate us as caregivers, but also empower us to be able to advocate for our kiddos. So, without further ado, because I know we're going to have lots to talk about, I am actually going to hand it over to Madeleine Oudin. And she's going to talk a little bit about the infantile spasm study that her and Dr. Hammer are working on. And then we'll move forward into a prospective study that Dr. Hammer is working on as well.
All right, thanks, Casey. Hi, everyone. It's great to see everyone. So I'm Madeleine Oudin. I'm an associate professor at Tufts University, and I'm also mom to Margot, my daughter who has SCN8A. And so I'm going to talk about a study that Michael and I kind of discussed starting a while ago and is now really going, that's really near and dear to both of us on infantile spasms. And so, this is a study on this seizure type, and I'll just introduce it briefly. This is Margot, having a spasm. It's a specific type of seizure that usually the onset is between 3 and 12 months. That's why they're called infantile, but they can just come on later in life. And that's when they're called epileptic spasms. So it's not just starting early on. But they have these kind of typical repetitive, very subtle movements of jerking like this. And so they don't look like much, but they're, really aggressive seizures, and they happen in clusters like this. And they also have this special EEG pattern called hypsarrhythmia, which is happening even when the seizures aren't happening. And it's like a white noise in the brain that makes it really hard for kids to learn. So basically, these seizures, are very aggressive, and they really prevent children from learning things. And these, happen in our community. And so, our study is a caregiver questionnaire online that takes, about 15, 20 minutes to complete, where we want to learn from the caregivers about their experience with this particular type of seizure, infantile spasms. And, we can learn a lot from medical records. But, I don't think that like all the information about Margot's experience with spasms is is all in detail in the medical records. And so, I think learning from the caregivers is so important. And that's why I wanted to do this, because I know as a caregiver that, I know a lot of what happened and I experienced it. And, I want to share my story, and I want to hear from all the caregivers, who had children with spasms, to hear about their story, so we can learn a few things. So I'll just highlight a bit kind of what we're hoping to learn. So far from the data in the registry, there's about 25% of patients that have infantile spasms, but we're seeing that in some regions of the gene, and this is a particular region where Margot's mutation is, if the P position of your variant is in between these 30 different positions, there's actually a much, much higher incidence of infantile spasms. It goes up to about 80%, which is shocking that, in this small region, these mutations, a large majority of the children have infantile spasms. So we're trying to figure out, what patients in our community get infantile spasms. Are there certain regions where there are spasms? Can we educate parents when they get a diagnosis? Because now we're getting diagnoses earlier and earlier, that, okay, your child is at high risk for spasms. So can we educate? Can we have, neurologists ready to start treatments? And then, we want to learn, okay, is there also kind of patients that are a bit older that get epileptic spasms? And is that common in our community as well? Because infantile spasms are different than other seizures because time is brain. And so there are studies showing that every delay that comes, every week of delay, that comes with starting medication for this can lead to worse developmental outcomes and decreased certain points on different tests to look at intellectual disability. So we want patients to be treated really aggressively. And so if we can, again, know which patients are at high risk for spasms, we can educate families so they can get access to treatment quickly. And delays in diagnosis are really common for these type of seizures because, as you saw, they're super subtle. They look a lot like reflux, sorry. And so many times they're really misdiagnosed by many pediatricians. This occurs in about 17% of patients. This leads to more delays. And there's studies showing in the US that kind of, if parents don't speak English, that kind of delays access to treatment even more. And so we want our population to be ready and to know if this is going to happen to get access quickly. So the current treatments for spasms, so spasms are treated independently of the underlying diagnosis. So it doesn't really matter that it's SCN8A. They're treated with steroids and Sabril or vigabatrin. There have been no new treatments for spasms in 40 years, which is just really, really depressing. And unfortunately, 1 in 3 kids initially respond, but then that initially respond will then relapse. And we don't really know who's going to relapse, for who they're going to come back. And so, there are other treatment options, but they haven't really been studied that well in terms of specifically SCN8A. And so the big issue with a lot of the studies out there is that spasms can happen from a range of different causes, from genetic mutations like SCN8A, from structural brain issues or an injury at birth, for example, and also through other unknown mechanisms. And most studies pool all of these together. So they look at which drugs work best for all of these different conditions. But, we know that our genetic mutation SCN8A causes other things, and there's no studies that really look at spasm drugs for specific genetic mutations. And so neurologists are really interested in trying to know, like, okay, if kids have specific mutations, maybe that might impact how they respond to a specific treatment. And so the other thing is what drugs to try. And so I'm just going to run through this quickly because the details don't matter. But this is Margot's journey with infantile spasms, which is really rough. She started with initially focal seizures, then she had spasms. This is a number of spasms a day, up to 150. It was horrific for her. She started the first steroid med. That didn't work. Then she started the second med, stopped for a bit, but then they came back. So then we started another med. In the meantime, she had a different type of seizure. Then she started steroids again. That helped for a bit, but then they came back. So then we started keto. Then we started Onfi. Then other seizures appeared. So it's a lot, right? Like, it's messy, it's a lot. And I know this is common to other people who've had spasms as well. So for this, we want to learn what treatments worked for our kids. Did they need to try 4 or 5 different things for spasms? Can we then use that to tell neurologists, like, okay, if a kid with SCN8A has spasms, you need to treat them really aggressively with these different things because the likelihood that they're going to respond to the first medication is really low. And then there's some evidence that sodium channel blockers, which we know are commonly used for SCN8A, can actually affect spasms. And it's not clear, and that's something neurologists are really interested in, is, if kids took sodium channel blockers, did that help or not help their spasms? Because that's a big question that they have. So, we hope to learn kind of from your perspective, what that experience was in terms of the different medications and what worked better or not. And then lastly, we're really interested in prognosis. A lot of us, when we get a mutation, a new diagnosis, like, we just don't know what the future holds for our kids, right? And unfortunately for spasms, there's some data that's really hard to look at. And again, all this data is for like different types of causes of spasms. So it's hard to put that in context with what that means for SCN8A. And that's what we want to try and understand. What's the prognosis for children with SCN8A who develop spasms? Because in generally, patients who have spasms, 94% of them will develop seizures, will still have seizures later on. And many will progress to Lennox-Gastaut syndrome, which is another type of brainwave that can, and type of epilepsy that some of our patients have. For development, only about 10 to 25% of those who have spasms can achieve normal cognitive development, and they're generally severe learning difficulties for patients, that have spasms. And then, there is a high rate of mortality for those associated that for the patients that have spasms, depending on the study, between 17 and 31%. And so, that's important for us to know as parents, and the main thing is that, for patients under the age of 5, the leading cause of death is actually respiratory failure. It's not SUDEP. And so while SUDEP is important, kind of focusing on these other kind of approaches to making sure they have good respiratory support and good support for GI, that's what we deal with Margot. And so, if we can really show that this is common in families who have spasms, then again, we can encourage families and work with their clinical teams to provide all the support that they need and be proactive about intervening and, improving outcomes for our children and improving their lives as much as we can. So, what we hope to learn as well is what are the outcomes, for patients with SCN8A that have infantile spasms, do they develop additional seizures, what seizures, and, what is their risk of death as well.
This
So
is,
this
go
is,
ahead.
oh, sorry.
No, you're fine. Go ahead.
Okay. So this is what we're hoping to learn. So again, this is a questionnaire online, about 15, 20 minutes or so, kind of talking about your experience with spasms. And if you've already participated in the SCN8A registry, then you should have gotten an email on this in June or so about this. But if you haven't, then I will also share this in the group chat after, but there's a link to go to just complete that spasm part as well. So, we can share that with you. And if you can't find the email, I can help you find it. I'm also, if you're not comfortable in English, I'm happy to also help in some way in terms of, doing a Zoom with you or helping, with translation. I'm available to meet by email. You can message me on the Facebook groups or by email. Right now, we have 10 people who have completed the questionnaire. So thank you so much to all of those who have. And our goal would be to get up to 40. So we have a way to go. But, we really, appreciate and thank you for taking the time. I know that everyone is really busy, but hearing from you and having kind of your experience matter and help, current families dealing with this and future ones is really important. And so we really appreciate the time that you would spend on this. So thank you. If you have any questions, again, you can please message me. And thanks so much for participating.
Thanks, Madeline. So I wanted to just kind of touch base on something that I think is going to be a reoccurring thing today, especially. And one of them is, I think about how all the questions that come through our Facebook support groups. And some of them are infantile spasms. Sometimes some of them are, development and behaviors and all the things. But essentially, parents are wanting to know the information that you also want to know, right? And you're trying to collect. So, especially when we think about infantile spasms, you're in an emergency situation. You want to know what's going to work best. What med should you try first? All of those things. And there's just not a whole lot of scientific data, as you shown today, that really supports a robust answer to that, right? Instead of it's, all of us parents just trying to help as much as we can. So this study, I know 15 minutes, and I know sometimes 15 minutes is literally like the difference between us taking a shower for the first time in a week versus, doing this study. But it is so important, right, for us to be able to push the science forward. And I just want to take an opportunity to thank you both. Like this is like things that you're doing out of the goodness of your own heart. Like you are, SCNAA parents. You have also, Madeline, you have a lot on your plate too. And Dr. Hammer, you have a whole lab that you're running. And so for you guys to do this and work on this and try to find this information out for our community, like huge thank you and appreciation. There was another train of thought that I had, and I knew I should have wrote it down. Oh, I know. So the patients that you want, or the families that you want to fill out the survey, do they need to have a confirmed IS diagnosis, or what if the parents are like, "Gosh, I really feel like we had that, but I didn't, and no one ever told us that's exactly what it was."
Yeah, so we have questions that look at that and we ask if you did have a diagnosis and did you have an EEG that confirmed it or not, or if you suspected it, if you thought it was there but it was dismissed. We ask like, why was it dismissed? Again, kind of reflux is a common reason for
Mhm.
dismissal, but we also leave room to answer and to say if there was something else that was dismissed. So yeah, so there's, you can definitely put that information, and we want to hear about that as well. We want to hear about everyone. Um,
Okay. Perfect. So what I plan to do too is once, obviously everyone knows that this is recorded. So when we release the recording, I will also put the links in the comments for each one of the studies that we're talking about today too.
Great. Thank you.
Cool. Yeah. All right. So we're going to move on to Dr. Hammer. And Dr. Hammer is going to talk about a prospective study that he's working on also with SCN8A. And again, another theme here is going to be we have, ways for scientists to be able to get access to medical records through Citizen. We also have the registry, but there's this gap of information that's really our day to day that I think and they think is going to be extremely important as we move the science forward. So, Dr. Hammer, I'm going to hand it over to you and you can talk about your perspective study.
Thanks, Casey and Madeline. That was a great presentation. Yeah, I mean, the common theme here is we need the community to rally behind these projects to help us get this information. And today I want to talk about one of the biggest gaps in our knowledge. Madeline's already referred to it, and that is we don't have great documentation on a daily basis what's going on with our kiddos. And that is a big gap in our ability to do better with the medications we have today while we wait for novel and transformative therapeutics that we hope are on the horizon, but it's going to still be some time. So this is a project where we're going to try and get information from you through a app on your smartphone where you go in every day and you enter daily seizure and medication data. We're going to integrate the data with a survey that we're going to give you every 3 months that's going to ask you about developmental milestones and other aspects of your child's life, whether there are illnesses. And we're going to also integrate clinical data from electronic medical records and quality of life assessments for both you and your child. And we're going to integrate that into a computational pipeline to eventually come up with a more personalized treatment plan for better outcomes. That's the ultimate goal. So basically,
Michael, do you want to share your slides in presenter mode? Because they're not like,
oh,
I
okay.
mean, just so they're bigger and
Yeah, I didn't know
like a
they were.
slideshow. Yeah.
Tell me if that does it. No.
So flip, you say go use slideshow at the top up there. Yeah. Yeah.
Okay.
There we go. Looks better now.
Thank you. So this is an overview of the whole talk. If you fall asleep, this is all you need to stay awake for the next 3 minutes. Um, Transformative therapeutics is where we want to go. And that's what Madeleine's working on in her lab. But we know it's going to take time, perhaps years, for novel therapeutics to be available to us, so whether they're small molecules or gene therapies. So what do we do in the meantime? Current therapeutics. There are many anti-seizure medications that are available, but we still have very high refractory rates. There are no protocols for prescribing ASMs or their combinations, or there's no information on the best one to add first or the order in to add them or wean them. And there's little consensus that exists on the best medications for different patients. So what do we need? We need granular data on dosing and effects. We need consistent treatment protocols. We need caregiver and clinician-based assessments of outcomes. We need caregiver-based metrics on quality of life. And what we do in my lab is we do statistical analyses to correlate all of these kinds of data streams into understanding how seizure burden changes, whether it gets worse or better, and what causes those changes in seizure burden, and what are the effects of changes in seizure burden in terms of our developmental skills that we acquire and how we progress through this from until adulthood. So we really want to know answers to all those questions, which I know all of you have. So the overview of what I'm going to present is I want to just highlight we've made so much progress in the last 13 years research-wise, but we still have some very important gaps. So we had a roadmap meeting, and I'm going to tell you just some of the outcomes of that meeting that directly impact what I'm going to talk about today, and the challenge of how do we get the data we need. Collectively, our community has the data we need. We just need your participation in these research studies, both the infantile spasm survey and this, what I'm talking about today. And so you guys hold the key to us moving forward. What, as Madeleine mentioned, we have electronic medical records, but do they really fit the bill? Do they really solve the problem? I'm going to take this opportunity to tell you about the Citizen Project that many of you participated in. And I'm going to give you a little bit of feedback on how that all went and ask whether that was enough for us to get what we need. And the answer is no, the challenge still remains. We still need to get accurate seizure data on a more granular basis. The solution I'm going to talk about is how do we document daily seizures with an e-diary? We use this app called Helpilepsy. It's on your smartphone, and then the research studies and how you can participate and make a difference. So I can't go through all of this. This is our success as our community. It's represented here with some of the things we've accomplished, not everything, but we have, since we identified the gene as an epilepsy gene in 2012, all the way to 2024, and I haven't even included 2025, we've gotten all the way up to clinical trials. We've got mouse models, we've got iPSC models, we've got gene therapies that people are working on, animal models, and we're really making amazing progress. Then we've got our advocacy groups that have made such a huge difference. TCSF, Wishes for Elliot, the Shayma Hammer Research Foundation, all these things were also instrumental in us making this kind of progress. The scientists and clinicians, they've gotten all these different models, and we've published. This only takes us to 2024, but over 463 papers on SCN8A since 2012. This is an example of rapid progress, and we should be very proud of that. However, despite that progress, there's still gaps, and we know what those gaps are. Our medications are inadequate. They're not selective. Polypharmacy, which means, we're taking more than one medicine. We don't understand the interactions and which medicines work best together. It's very hit or miss. We don't understand the disease mechanism fully, even though we understand that the channel is problematic, but either it's gain of function or loss of function, but there's so many more things we don't understand. We don't have treatments for non-seizure phenotypes and comorbidities, and we don't have a strategy to deal with a high premature death rate. We lack biomarkers to track disease progression and treatment response. So how do we accelerate progress in these areas? And the answer to that last year was to get a meeting together. And Madeleine and her husband, Chris, were so great at being able to organize this meeting in Boston that brought more than 40 people together that included caregivers, clinicians, researchers, laboratory researchers, pharma, biotech. And we had an amazing meeting for 2.5 days. And it actually ended up being a publication. We summarized it all in one big publication called A Research Roadmap. It came out in Orphanet Journal of Rare Diseases recently. If you want to get it, you can go to my website, scna.net, and go to publications. You'll see all of the publications there, or you can email me at info@scna.net, and I'll send you a PDF. But this is here. You can see over here in the corner, we did a survey before the meeting. We got 175 caregivers to answer a survey, which was amazing. And we had 46 clinicians and 23 scientists all fill out surveys before the meeting. So we really knew the kinds of things we wanted to focus on. I'm just going to show you one slide of some of the survey results. The point is, when we asked caregivers to rank the importance of research to control seizures, everyone really agreed on we need better effective drugs, and we need to understand drug combinations. Off-label meds, too, are very important. Clinicians, similar question, rank the importance to improve treatment. Doctors felt that first-line and adjunctive medicines were important, and optimizing polypharmacy. So there's great correlation between clinicians and caregivers. Scientists are mainly working on more novel therapeutics in their labs, gene therapies and things like that. That was their major ranking of importance. But, repurposed drugs and combination therapies were also important to scientists. So we have a lot of agreement on where we should align our priorities going forward. So just to get back to the problem of where we're at now, clinicians are challenged to prescribe these drugs based on a trial and error process. We know it's all trial and error. There's no theory, there's no protocols that they can stick to really follow A, B, C, D to get us to where we need to go. And despite what we have, access to so many different drugs, more than 75% of patients have failed 2 or more, which is a term called medically refractory. And 85% of patients are taking multiple drugs. That's polypharmacy. So that complicates our efforts to understand what's going on. So choosing the first line meds is difficult due to this lack, as Casey said, evidence-based data to support the selection of the many medicines that are on the market. And multiple sources of info can inform us on clinical management, such as electronic medical records and the registry. But the question is, are these sources collecting data at a granular enough level? That means like on a daily basis. Is that enough? Do registries and EMRs provide the necessary fine-scale data to determine what we need to know? So I'm going to talk about citizen health for a minute here. For those of you who participated, you know what it is. For those that did not, Citizen Health has a centralized medical record data system to get from patients, as seen by a lot of different doctors all over the place, and it's centralized into a single repository. When you joined it, you gave permission to give your data to allow Citizen Health to provide your data to the Shamahama Research Foundation for research purposes, and 80 families did that. And in our lab, we've been working on this for 2 years to write computational codes for pipelines to analyze the data that comes from those records. It's very complex. It comes in hundreds of rows and columns and spreadsheets. It has to be organized and coded in zeros and ones so computers can analyze the data. And we spent the last 2 years doing this. And as I'm going to tell you, we just submitted a paper reporting this to Epilepsia that is in review. But the average time for patients to be followed in electronic medical records, and this is the real strength, 7.9 years is the median number of years. So we got a lot of years of data. The question is, was it granular enough? So this is just figure 1 from the paper, and I just wanted to show you quickly a couple of, these are summaries across all 80 patients, and this is just showing you the kinds of seizures. So we do start out a lot with focal seizures, but then you see tonic-clonic become the major seizure type. Here you can see infantile spasms represent proportionally a very large percentage of seizures that are initially reported. And of course, they're infantile and they tail out by the time we're no longer infants, but these later onset spasms continue for much longer. My daughter Shay had a late onset spasm-like seizure that started when she was 4. And that was a very difficult seizure type for us. I'm not going to go into the other things shown here, but we have hospital visits and reasons for hospital visits, comorbidities, and then things like weight, height, head circumference, changes over the years for boys and girls. That's all reported in the paper, and I'll report back on that some other time. But the thing I really wanted to point out to you was we were able to take all 80 patients and we were able to make these graphs of a single patient with lots of characteristics. So look at the bottom here. This is 5 years of data. There's office visits for those 5 years shown in green triangles. This is a single individual patient in the Citizen Health database. And what we've got here is the medicines they started with in the order they were prescribed, first to last. Here you can see levetiracetam, oxcarbazepine, gabapentin, and so on. And you can see when they started and when they weaned each drug. And then we have adverse events on this line, and then seizure types, tonic, focal, tonic-clonic. And then the red dots indicate, based on how many seizures you reported at an office visit, the particular intensity of that seizure type. So a larger red dot means a more intense report of seizures. It's not a seizure frequency. It was like, oh, my child had so many seizures, tonic-clonic seizures in the last 2 months since I last saw you. And we try and turn that, we have a seizure index that gives us a intensity score. So it's not an actual frequency, it's an intensity score. And then we've got EEG, whether they were normal or abnormal on this timeline. We have status events on this timeline. So this was the basis by which we took all 80 patients. We developed this longitudinal profile, and then we analyzed across patients to see what kinds of patterns we could find. And one of the things that I thought was most important, it's not perfect, but we looked for gaps in the seizure reports. So there are office visits, but there are no reports of seizures in this period. I would call it a period of reduced seizure frequency. We can't say for sure there were no seizures because these are medical records. But then we tried to correlate that with like what drugs were added that might have been responsible for that seizure reduction. And so we did a big analysis across everyone to find out what medicines those were. In this case, it looked like valproate and rufinamide were helpful. I just wanted to contrast that with a patient with infantile spasms, which is shown on this line, just to make the point that this patient, over 150 months, this is a very long data collection period, never really found a period that we would call a gap or a reduced seizure frequency time period, because infantile spasms are serious not only in the initial phases, but they tend to evolve into multiple seizure types that are very difficult to control, like myoclonic seizures. And then, as Madeleine mentioned, that Lennox-Gastaut, that's a phenotype that's based on EEG that is very difficult. To do the analysis in the gap, I called monotherapy. So which medicines won as the ones that were overwhelmingly used in the gap? And it turns out if you look at the black line, that's the ones that were monotherapy. And I've put that up in the corner. You can see these drugs often were found as the single drug in the gap, oxcarbazepine, lamotrigine. They happen to all be sodium channel blockers, which is interesting. But you can see GABAergic drugs like clobazam and Epidiolex also were used, maybe not as solo drugs, but as drugs in combination in those gaps. And so this is the basis of the paper that we submitted, and I will report back on that at some later point. We also just got a paper published in Epilepsy where we used machine learning to try and predict medications based on the registry data. And that paper has been accepted and it's about to come out in Epilepsy, and I will make that available to you. But you can see what we were able to do is, and we used clinicians, we used the model and we tested how well the clinicians agreed with the computational analysis on the best and worst medications from your data in the registry. And we asked you whether medications were best because they reduced seizures, reduced duration, whether they increased alertness, or if they had side effects. And based on that combination metric, caregiver provided combination metric, this is what the FDA is asking for. We use that in our computational model and compared it to what clinicians would have done given the same basic information about each patient. So it's really interesting study. And we also found that oxcarb, lacosamide, carbamazepine, lamotrigine, phenytoin, and clonazepam were all predicted to be best by the algorithm, and we were also able to show that the algorithm never predicted use of a detrimental drug. So even if we couldn't find the one best drug, we were able to say which drugs not to use. And so anyway, I won't go into that. It's just an example of how the registry and all the work that you guys are doing helps us get data like this out to clinicians and to the public. So the problem is, as we mentioned, that documentation of seizure frequency at office visits is not an accurate account of seizure history. And the mean office visit frequency is more than 2 months. So we're not really getting accurate seizure frequency data that we need to know what factors are leading to seizure burden improvement or things getting worse. And so that's pretty much the summation of this slide, that whether it's the registry where we get annual updates or the electronic medical records where you see a doctor every few months, doesn't give us the granularity we need. So what we're doing, we're creating this pilot prospective study to collect multi-source data, daily seizure and medication entries from you using a smartphone app. And so the point is to collect the granular data, to use a well-vetted FDA-approved application for seizure tracking and back-end data processing. So there was only one company we found that has an app that's fairly easy to use, but also the data that you enter goes to a dashboard that is private and secure that we can access to get your data back. There aren't any other apps out there that are cost effective and are able to do that. So the one that we've decided to use is Helpilepsy. I know it's a tough word to say, Helpilepsy, but it's an app that you can download. It's free. You can put it on your smartphone and you can start using it. And I'm going to tell you how you can participate in the study. It works for both Apple and Android. So basically, the dashboard looks something like this, where you can see seizures are recorded here, and there's different seizure types you can enter. It doesn't matter if you have 3 different seizure types. It captures all of that. It captures all of your medications on a daily basis, and this is summarized over months, but we can get it over days and weeks. And it's just an example of what the dashboard looks like. And then we're going to take the data. This is another patient. We're going to take the data and we're going to integrate it into our pipeline to do analysis to look for correlations between the kinds of things that are happening with medication, seizures, and then with the prospective study that you do through the registry, which only takes 10 or 15 minutes as well. We're going to be able to correlate that with changes in lifestyle development and all of that. There is no place to be able to do this today. So this is a very novel and groundbreaking study. So the basic study is we want to recruit 50 patients. We're going to do training. We want to have a 20 patient cohort in the end. After we know not everyone will successfully be able to use it on a daily basis, and they won't be highly compliant, but some will. That's just the nature of things, in the world. People can't do it every day. So we're going to try and get a reliable cohort at the end of the day and integrate all these different data points for about a 9-month period. And once you fill out that prospective survey, each time you do it, you'll get a gift card. So we're going to try and give you a little bit something back for your participation. So this is just a little infographic again, saying what we plan to do. It's going to empower our research team to identify better treatments, help us understand connection between your child's medication seizures and developmental progress, gain the opportunity to receive personalized infographics. We're going to give you back stuff too, and I'll show you an example of that. But to do it, you download the app. You can use this QR code to go to either the Apple or Android site. If you do that and you download the app at the Apple Store or the Android Store, then email me at info@scna.net to let me know you've downloaded it, and then I will direct message you on the app to accept you into the study. So it's a 3-step process. It's not hard. Email if you have any questions on how to do this. Then you will have just your daily checklist would be to open the app, log any medications, record any seizures, note any special symptoms, and confirm no seizures if the day was seizure-free. This is an infographic that we're going to provide back to you every month or every couple of months. It's just a nice way of summarizing what you've put into the app. It's going to show you your seizures in red dots and then the seizure-free days. So these are streaks of seizure freedom. It's going to tell us your average estimate of mood and sleep and how often you actually told us that which medications you were taking. And we can even see how often you log into the app to see how compliant you are in using the app. And we'll provide this and other information to you. We also started a WhatsApp group for those that participate in the study. So we have active conversations and questions and answer on a real-time basis. I also just wanted to highlight that your work is not going unnoticed or not being unused. In the registry realm, we've published a whole bunch of papers since 2023 and many before that as well. And you can find those all on our website. But I want you to all know that all of the registry information you've provided and the hard work that you've done is paying off big time. So again, here's what you do, and I'm going to end on this slide so that I can hold it here for a moment so that you can actually go and do it if you can. Do it today if you can. All right. That's where I'm stopping, and I think we have some time for question and answer, don't we?
We sure do. I will say you brought up that graphic of the app, and I was like, because so Stella has been having some really good seizure-free days, and then I swear once a month, about a week, she's having some more. And so I personally think that that could be hormonal. She's almost 10, hasn't, started her cycles yet, but I think her body's gearing up. So in my head, I was like, okay, I need to develop this Excel spreadsheet. And so I can make this plot graph so I can really show the correlation of those weeks. And then when I saw that that graphic, I'm like, and that does it for me. So so yeah, I'm excited. I don't know,
Absolutely.
but yeah,
Yeah, I mean, you can enter into the app. There's notes. You could say things about what you think might be going on hormonally. What we want to know is, even if you have rare seizures, your breakthrough seizures, why? Why do you have a breakthrough seizure seemingly randomly? Is there something that might have caused that or associated with it? And I think the ultimate question is, if we get better seizure control, do we develop our skills better too? I mean, ultimately, I think parents care more about development than they do about seizures. Seizures are a nuisance, obviously. In some cases, we care only about seizures because they're so bad. But for families
Right.
in the milder end or the moderate end, you want to see your kid go to school. You want to see your kid learn and gain skills and have motor and fine skills and academic skills. We want to be able to correlate what's going on over months to see if there are associations with improvements. Doctors don't know this. The FDA doesn't know this. Nobody knows this. And when we have transformative therapeutics and gene therapies, the ultimate test will, do they rescue a lot of these other comorbidities and these developmental delays? That's what we really want to know. And I think, as I say, this is an interim solution to make things better now while we wait for these more transformative therapeutics that are on the horizon, but not tomorrow. It's going to be a while. And Madeleine can maybe even chime in a little on when she thinks things like that will become available to us.
Yeah, not for a while.
Yeah.
Right? I mean, yeah, yeah. Even precision medicine, we're getting way closer than where we were before, hopefully, but we're still a long way from, that being hopefully approved by FDA and getting to the market and all that. So, um, also, so Dr. Hammer, on this app, do you like, would it only be beneficial for those that are having seizures, or would it be helpful for those that are taking, medication for behaviors or, other things? What are your thoughts on that?
Yeah, I think it's probably going to, I think the incentive to use it will probably be for those that are, giving medications for seizures every day, and it also has a reminder for you to do that. Um, but and let's not jump all the way to, like, say, loss of function yet. Let's say we want to go to the milder end where you're not having seizures on a monthly basis, but maybe you have breakthroughs like 4 times a year. One of the participants in our study is in that situation, and her daughter had 2 breakthrough seizures last month, and she has no idea why. It was the first time in months. So I still think there's value for those that have very low seizure frequency to understand what might correlate with breakthrough seizures. Now, moving towards loss of function and absence seizures, if you're able to count seizures, at least give us an estimate. I know absence seizures are so many a day typically, but if you're able to think, if you think you can get a semi-estimate, at least a consistent count, I still think there's value, because then we're going to be able to see if any of the medications for loss of function, whether it's ethosuximide or what other medicines you're taking, are making a difference. So I still think there's some value. I don't want to exclude anyone from being part of this study. If you're not having seizures at all and it's just behavioral issues, I think I don't think the app was designed for that. I think that's a really important thing to think about. Maybe we could find another way to do that. But are there medications for behavioral issues that are actually effective and working? We need to know that too. I mean, the roadmap made a huge point of that we didn't
Mhm.
have that, and we need to find a way to get that through it. The scientists can study animal models where they look at non-seizure outcomes. But I don't think we're quite there yet with, like, tracking that on an app. So that would be
Right.
my comment.
Okay. Sounds good. All right. So I think we have some time for questions. So you could either put it on the chat, or feel free to come off mute or put on your camera and ask some questions. I don't know about anybody else, but as you were talking, I was signing up. So
Okay.
now I'm kind of looking at the app, and so you might get this flood of emails stating that you have a
I
bunch of
hope
people
so.
signing up, right? That's what our hope is.
Yeah, I hope so. And there are also people on this call that are in the study. So if anyone wants to, speak up and say a testimonial, or, how it's going, that would be great too.
Hi, Tammy.
Hi. So if I can do the app, anybody can. I'm
Love it.
terrible. So, I never ever kept track of Liam's seizures, but I was able to count back when I had my neurology appointment and say, hey, he had like 18 seizures. And so I find it helpful that way. Um, and then I can look back and say, hey, this week we had like 10 seizures, but we didn't have any this week. So I find it helpful for myself and for my doctor appointments because, you know, who's going to remember to write down, oh, he just had a bunch of focal seizures. But if you're going into the app that night, I do it before I go to bed. If I fall asleep, I do it the next morning. But and say, okay, he had that many seizures and just put it in. It's pretty easy.
I think that's a
So,
great point, Tammy, to make too, is that I don't know if anybody else has been in this mindset before, but if Stella is sometimes doing well quality life wise, but having a lot of seizures, I don't want to know how many seizures she's had. Like I would be like, I'm not even gonna count it. I don't want to know. She's doing well. So that's what we're gonna go with. But on the flip side of that, why is she doing so well? And what's that information behind the scenes that even though, yes, I maybe don't want to see the number, it could be very helpful to try to figure out, what's the correlation there.
right.
Yeah, I mean, then you're offering something to research to help everyone, even if you don't want to know on some days and it's a pain, but you're really helping the community by participating.
Hmm. Yeah. Hi there.
Hi, how are you? I hope
Good. How
everyone.
are you?
I'm good. I just came off camera quickly. My name is Noor. We are family from South Africa. We currently on the Praxis trial
Oh,
for
yes.
relutrigine. I wanted to find out, do you know if there's anything stopping us from participating in this study as well? If we're on the Praxis trial, we didn't know about, you know, Dr. Hammer, and yourselves. I think we signed up quite recently when we met some other families here. Um, my daughter got the 1621 variant, um, and I think we would like to hope, or we're hoping to think, you know, it's moderate or mild. She gets really small atonic seizures, but I also wanted to know if there's any way maybe, you know, we could connect with someone to get more information about, you know, this variant, you know, and then how it plays out, you know, as the kids get older.
Yeah, so yeah, sure. It's so nice to meet you. There are two questions. One is, can you participate in this study and be in Praxis? And the answer is yes, of course. You would just put, you might not know if you're on the drug or on the placebo, but you just put Praxis drug and we'll figure, you know, we'll take that into account. So please, also Praxis is very interested in the study. They're partially funding it because they need a platform like this. The drug companies are interested in this a lot because someday if we can do proof of concept here, this could be something that drug companies actually help us develop further and utilize because nobody's doing this kind of multiple data stream association type stuff. The other thing is, can you learn more about your variant? Yes, please email me at info@scn8a.net. Send me your genetic report. I get emails every week from people like you who want me to weigh in on their variant and what it means, and are there other people that have it, and who's been benefited from what drug, who has that variant. I love doing that. That's what gives me peace of mind every week when I'm able to connect with people like you, Nora. So please email me, send me your genetic report, a copy of it, and we can get into a conversation about your child and what's going on.
I
Perfect.
think and Dr. Hammer, I think it would maybe be important, and you tell me yes or no, when you're in the trial, maybe put like if you're in the actual trial portion versus in open enrollment, because if you're in open enrollment, then you know you're for sure getting the drug. So I don't know if there's a specific way that you would like for all of us to categorize that. That way it's consistent in your data.
Yes. So Elise Tanzer is the clinical coordinator working on this project, and she's also has epilepsy and uses the app. So she'll be the one that will be able to direct you to the notes page that would give us that kind of information. I can't tell
Okay.
you now off the top of my head where that would be in
Right.
the
Yeah.
app,
Yeah.
but
Maybe just
email us and we will get that very much to you. And once you're in the study and you want to join the WhatsApp group, you just throw that question out there and we all kind of we use our collective wisdom to answer your questions.
Thank you
Sounds
so
good.
much, Doctor. And I mean, just to so one thing we know about the study is that every family will at least get the medication for 12 out of the 16 weeks for part A. We currently in part A, and then the placebo is for 4 weeks of the study. So hopefully we'll definitely get, I mean, I'm sure we definitely get the medication.
Yeah, and then the open label part, where, as
Yes.
Casey mentioned, then you're on the drug. And the great thing is you can stay on it for as long as you need to before it's available.
Yeah.
Right.
So
And I
we'll
think it's,
definitely reach out to you. Thank you so much.
Yeah, thank you.
Participate. Yeah.
I just want to take a moment to say to thank you to anyone on this call that is participating in the drug trial. I know personally how much of a commitment it is. And I don't have to leave my house. So those of you that have uprooted your life and traveled to another country, holy cow, salute to you. Greatly appreciate everyone who is doing that. And I know all of us are on this call because we had an interest of participating in research, right? And maybe you're not at a point where either A, you're not eligible for a clinical trial, or you don't have the capacity, because it's a big commitment. So maybe you don't have the capacity to do that right now. We're not so what research can you participate in? And we just provided two great opportunities. The infantile study, spasm study that Madeline talked about, and then the prospective study that Dr. Hammer talked about. And then we also talked about the Citizen a little bit. And so TCSF will be holding another webinar with Citizen at the end of October. So if you're not signed up for that and you're interested, then we'll provide some information on how to do that. And then I know Dr. Hammer, you'll be talking about the registry. And if you haven't participated in that, then there's a way that you can do that as well. And you usually do that a little bit later in the year or maybe the beginning of next year. But there's definitely opportunities for everyone to participate if you choose to do so. Obviously, it is your choice. No one's pressuring you to do any of these studies, but it would be extremely helpful, I believe, to the community.
Yeah, we would greatly appreciate that. And I think the infantile spasm survey and the prospective study go nicely together, because we want to extend the infantile spasm study to something that we can carry on going forward to see what happens over time. And we know that people with infantile spasms are going to be the best prime candidates for a prospective study because of the complications that could come and the things we need to learn.
Let me ask you, if we have a family that is bereaved, that has unfortunately lost their child to SCN8A, would they still have an opportunity to fill out the infantile
Yes,
spasm study?
absolutely. Absolutely. We know, unfortunately, that there are quite a few families whose children have had infantile spasms and where the children have passed. And we absolutely, would really welcome their participation because there's so much to learn. So yes, 100%. And yes, I wanted to, reach out to some of them individually as well. But
Mhm.
yes, definitely. We want your participation. Absolutely.
Okay, sounds good. So ideally, I know for the IS study, we said we needed 30 more participants. I forget, Michael, how many more participants are you hoping to get in the prospective study?
I would like to get 20 more if we could.
Okay. All
We,
right. So we're looking 20, 30 for both at least.
yeah. Mhm.
And do you have a particular timeline that you're hoping to get all of these participants?
Well, the nice thing about the app is you can start using it now, and whenever you join the study, we can get all the data that since you've started. So even if you're not sure you want to do it, just start using the app, because if you do decide to join, I can see all the data you've entered from the day you started. But I don't think not everybody's going to cross the finish line at the same time. I've already seen that. So the sooner the better, but is it better to give people a deadline? Does that make it more
Right.
compelling? I don't know. I mean, I just want people to join as soon as possible. And I think the same for the infantile spasms. We want, it takes time to do the research once we have the data. So
right?
Yeah, I think we're hoping by the end of the year. It would be great to have all the data. First week of December is Infantile Spasms Awareness Week, so I hope that can be the deadline at the end of that, so that then we can get as much as we can and start analyzing and putting together the data and to eventually write a paper to get this out there and shared with the community, with neurologists. So that's kind of my goal for the spasm study, to try and collect as many caregivers as we can by early December. Maybe a last push at the gathering, and then
Right?
and
Yeah,
then right after the
exactly.
gathering. Yeah.
No, I think that's good. And like you said, Dr. Hammer, like a deadline, I don't want to pressure anybody about, but at the same time, as a caregiver, you might go, okay, well, I don't have the capacity this week to even think about it, but maybe next week or maybe even October, then I'll have a little bit of extra free time, or some free time. How's that? To be able to add that to my plate. So, okay.
Yeah. And our webpage, I was just going to say our webpage, SCN8A.net, if you just go to that site, prospective studies lit up all over there, and you can click and get the QR code if you weren't able to get it.
Sounds good. And like I said, when I release the recording, we'll wrap up a nice little bow, with all of the links, and so everybody can find everything in one spot. All right.
Awesome.
Do we have anything in the chat? I don't think we had anything that we didn't get, but I wanted to make sure I didn't miss anybody's questions before we wrap up. Want to be cognizant of everyone's time.
I think we got to everyone's comments.
I think so too. Well, I will just wrap up and say thank you so much, Madeleine and Dr. Hammer. I I I just can't explain like how important it is, for us as a community to keep moving forward. And for both of you, we're so lucky as a community to have two scientists, in our community that are willing to do this. So really, really appreciate you and all you've done for our community.
Yeah, it's my
Yeah.
pleasure. And I'm sure Madeleine feels the same way. Dr. Oudin.
Yes.
Yes, I know.
That's all right.
So yeah. All right. Well, I will wrap up in saying that we thank our two sponsors. We have Praxis Precision Medicines and Neurocrine Biosciences for allowing us the opportunity to be able to do this. And we will have at least 4 more sessions coming up in October and November. We're going to have, like I said, Citizen on. We're also going to have Dr. Lowenstein from UCSF talking about seizure classification. And then we're going to have Danny come on and talk about monitoring devices. And then we're also going to have someone that is a specialist in movement disorders. And so we'll really look at the different type of movements and help parents be able to identify those movements so we can advocate for our kiddos when we go to the doctor. With that said, thank you so much. Everyone have a lovely afternoon, and we appreciate you coming and spending your time with us.
Thank you.
Bye, guys.
Bye.